My name is Dr. Hillel Mazansky, and I'm the President and CEO of Medical Hypnosis, Guided Imagery, Nutrition and Exercise. On Facebook.com/guided imagery, all my YouTube video health tips are stored. Today's discussion is entitled, Doctor, why am I so tired? I have been asked that thousands and thousands of times in my previous life, and many physicians get asked the same question. It depends who the questioner is. If it is a senior, generally speaking, the cause is insomnia or the inability to sleep. And when they are unable to sleep, then the following day they are tired. Now, before I started doing YouTube video health tips, I used to write them out. You can go to my website, www.gianinc.com, click on the nutrition icon and go to weekly health tips, and there you will see how insomnia is managed. So the other group of people who ask me, Doctor, why am I so tired, are the younger group, those that are below 40. The vast majority of whom are females, but males ask as well. So when a patient asks us, I am tired, there are certain tests that one has to do to make sure there is no underlying cause for the tiredness or lassitude, as we call it in medical parlance. So the important tests to be done, first of all, is a complete blood count to make sure that the patients are not anemic. And that is mainly in the females who lose quite a lot of iron during their menstrual cycle. And if they are anemic, that can cause tiredness or lassitude. The next thing that has to be tested is the thyroid. An underactive thyroid gland leads to tiredness. Third, you need to have a blood sugar done because diabetes or pre-diabetes can lead to tiredness. The fourth thing, especially for females, is to have a urine check done, a urine culture and sensitivity, because oftentimes recurrent bladder infections or UTIs, urinary tract infections, can cause patients to be tired. Now, let's assume that all the tests have been done and it's negative and the patients are still tired. They will say to me, Doctor, I am tired when I wake up and I'm tired when I go to sleep. And that is the clue. They are suffering from undiagnosed depression, because depression can make one feel tired. They don't feel the depressed feeling or the pain of the depression, but they do feel tired. And once you start talking to them and investigating, you find out that they are depressed for whatever reason. So how do we treat it? Well, traditionally out there, they're given antidepressant medication with all the side effects, and oftentimes they don't work. But in our office, we do a medical hypnosis session on them and try and delve into the subconscious to find out the reason of the depression. Secondly, the patients are given a highly nutritious eating program, because oftentimes some of these patients who are tired their nutrition leaves much to be desired, and as a result of incorrect eating, their blood sugar drops and they feel tired. So a highly dense nutritional program is given, filled with antioxidants and omega-3 fatty acids. And then they're encouraged to exercise. The more they exercise, the better they feel, the less tired they are, the less depressed they are, because when one exercises and increases the pulse rate, you secrete endorphins in the brain, the feel-good hormones. So after a stint of exercise, with a good meal before or afterwards, managing the symptoms of depression, no more tiredness, they're alert, they're awake, and they feel good. Another cause that we see that causes tiredness and inability to cope is fibromyalgia. We have discussed that in a previous YouTube video, but fibromyalgia is extremely prevalent, and they use certain medication that have got side effects. But at the basic root of fibromyalgia is stress. And once we're able to get at the stress, find out through medical hypnosis, delving into the subconscious, we find out what the real stress is, we treat that, and the pain of fibromyalgia disappears. Similarly, there's a condition called chronic fatigue syndrome, and that's also discussed in my previous health tip on the website. Chronic fatigue syndrome is not as prevalent as fibromyalgia or as depression, but does exist. And this is a really severe form of tiredness and lassitude that the patients sleep all the time and they cannot even get off the couch. Getting off the couch needs an extreme amount of effort is exerted just for them to move, and they don't eat correctly, and they certainly cannot exercise because they feel too tired. Again, when we have patients with chronic fatigue syndrome, a highly nutritious eating program is given. They are encouraged to exercise, starting off very slowly, just walking for 5 minutes and increasing slowly. And then they undergo medical hypnosis and a guided imagery session, which is recorded, and they listen to the voice twice a day. And once more, it is oftentimes a deep-seated psychological issue of stress or anxiety or depression that goes back to their childhood. And oftentimes they repress that in their minds and they've forgotten about it and they don't even remember what the real cause was. But under deep hypnotherapy, we discuss with them what happened during their childhood, etc. And oftentimes, the real cause becomes self-evident. We treat the cause and they improve. If you are tired, we recommend a couple of cups of coffee with caffeine. That might pick you up. But the cause needs to be treated. And it's nutrition, 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 exercise, 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 and then the hypnosis and guided imagery. And using those three things, what happens? They refer their friends to us. My name is Dr. Hillel Mazansky, and I thank you for listening.